hospitals, schools, police departments, and more. Many organizations employ chaplains to assist with the spiritual, religious, pastoral, and emotional needs of patients, families, and staff. In any emotionally trying situation, a chaplain can provide the support we need during a unique or challenging time. Join us as we discuss the importance of well-trained chaplains and how that benefits patients on today's episode of CHS Presents Lifestyles at the Heart of Health. Hello, everyone, and thanks for joining us. I'm Jane Hansen. Pastoral care staff and volunteers provide healing and spiritual comfort to those in need for people from all walks of life and of every religious belief and ethnic group. Joining me now is Jim Spencer, Catholic Health Services Senior Vice President for Mission and Ministry, to speak about the clinical pastoral education and chaplaincy programs at CHS. Welcome.
Thank you. It's great to be here.
Well, and obviously a big part of Catholic Health Services is the mission of mercy, the mission of faith. So talk about why that's so important to the system.
Well, absolutely, that to be faith-based and mission-driven is essential in today's world with the values and people often looking at things that are just purely profit-driven. Profit's not necessarily a bad word, but we are really committed to doing the right thing for the right reason and to serve our patients well, body, mind, and spirit.
So combining body, mind, and spirit, sometimes when you think about a hospital setting where that's so clinical and there's such immediacy and such attention paid to saving lives, that sometimes you think the spiritual part of it might get lost, but not so here.
No, part of Catholic healthcare, and in particular Catholic Health Services of Long Island, is a strong commitment to pastoral and spiritual care. That component that often gets overlooked is really essential to total healing. And so we really have phenomenal chaplains, well-trained chaplains, all have done master's degrees or 1,600 hours of clinical pastoral education.
So there's a real science to it, so to speak, a science to the faith.
Yes. And how do you, as a chaplain with your own faith background, really not impose that on on patients who have your same faith or maybe in a different part of their journey or people of other faiths. So it's really, really essential that you know how to and have been trained well to practice that and provide real healing.
You call it CPE, Clinical Pastoral Education, when we speak of this education component. Exactly what is that?
Yes, clinical pastoral education is really a process that really prepares chaplains to deal with those situations that come across and can be very traumatic, can be very painful, can be sometimes covered up, overlooked, and to elicit a listening presence and to really tease that out where the patient is ready, and their techniques and sometimes even silence and letting the patient speak. We're often in such a rush that we can listen to the patient, and we don't. How many times have you ever been talking with somebody and you can't wait until they finish saying what they're saying so you can speak? Chaplains are well trained to listen.
Well, that happens to me all the time in this kind of a role, but I understand it. Now, why did you, in particular, decide you wanted to focus on this and take these kinds of courses?
Yes, I was in a theology program, an academic theology program, and I really, having a healthcare background prior to studying theology, I was a pharmacist, and I really was interested in the role and the value that spiritual care can play, how it can benefit patients, family, true healing, and be of value to an organization. And I wanted to learn about that in a language that administrators and finance folks could understand, so I could advocate. And one of the priests where I was studying theology suggested that I do a clinical pastoral education rotation. And so I rolled up my sleeves and did that, and it was the most enlightening experience I've ever had.
Well, how does that differ from being, say, a pastor in a church or a or in academia? I mean, how does the faith part of that change up?
Yes, I think in healthcare, people are unique and they have a history, an experience. They have their faith, their hope, their love, and they just have experiences with life and healing and health. And so I think being able to balance that and be ethical is very, very important. So it's sometimes baptism by fire. You're thrown into situations and patients have passed away, families reconcile. Sometimes families haven't spoken in 20 years with their siblings or family members, and there can be real emotional healing.
I was going to say, I mean, I can remember when my own father was very sick, being in at a hospital and immediately going to the chapel to pray, please, please, please. This is the time when you kind of try to make deals with God. Yes. So I can see that happening, but that must be a real awakening to see it with the same consistency that you do.
Yes, a lot of people say, why do you want to get a call at 2 o'clock in the morning and wake up and go and visit when it's probably not good news? But again, when you see the outcome and you have learned about people who have harbored hurt, spiritual hurt for years, and when it finally gets resolved well, it's just spirit lifting. It just, you feel lighter, and you feel it's great to be a part of that.
I bet you have some amazing stories.
Yes, I have one in particular that was really, and it absolutely shows the importance of the other clinical staff. In particular, this case involved nurses. We had pediatric nurses, and this was at a university hospital, and they called and they said, could you come visit this family? And we had a 27-year-old father, 25-year-old mom, a 2.5-year-old boy, had a 4-year-old brother. He was born with tumors throughout his body, and pain was natural to him. And so these nurses were so in tune with the spiritual needs of the family. There was a little distress, a little religious intolerance in the family. The mother was Jewish. The mother was Jewish now, formerly Catholic, and her mother very, very Catholic. The father was Jewish, and his mom was very, very Jewish. And they were arguing about what they were going to do and not do at the funeral of this 2.5-year-old boy. And they were an amazing couple and parents, but the family, the extended family, was just pulling them apart. The rabbi and the priest were doing their best, but they maybe didn't realize how deeply pulled apart this couple was. And so after talking, we just said, could you just kind of leave us alone, and we would try to be loving parents. And we said at the hospital we would do our best to minimize any religious intolerance. We talked with the priest and the rabbi. I got a call maybe 6 weeks later, and I remember the nurses said, could you come quickly? The baby could die today. And it was sad. But I was met at the door by the Catholic grandmother, and she said it's a bad time. Baby is not doing well. Now, I just want to say a note. Not every time the chaplain comes is somebody dying.
Right.
But, I said I knew her grandson, and I knew her daughter and son-in-law, and we'd talked, and they said, well, come on in, we're gathering around the bed. So we gathered around the bed. There were 3 nurses, family members, everyone around, and I just started by saying some of the wishes that the parents would like. To just love this child, appreciate his gift to the family. And then I honestly can't remember what the nurses said. It was like God spoke through these nurses. They just said all three of them said amazing things. It just changed the tenor in the room. And then one by one, the other family members followed suit, fulfilling the wishes of the parents. The last person to speak was the Jewish grandmother. And she said, why don't we pray the Our Father? I know, not a Jewish prayer at all. And so we held hands, we prayed the Our Father. The second we finished, the baby turned his head, looked at his mom, looked at his dad, and died.
Is that amazing or what? That gives me chills.
Yeah, you could feel the presence of God in the room, the energy, whatever you want to call it, was different. And I tell you, in that moment, 3 generations of family were healed.
We're healed. 3 generations healed. It's an amazing story.
And it happened on All Souls Day, November
Wow.
2nd.
Well, thank you for sharing that. You're
Yeah.
going to stick around. We're going to talk a little bit more with you later in the show. But in the meantime, we're going to take a quick break. Don't go anywhere. We'll be back right after this. Welcome back to CHS Presents Lifestyles at the Heart of Health. Chaplains proceed from their own faith in service of all people, but you do not have to be religious to experience the compassion that they can offer. Joining me now is Stephen Ott, the chaplain at Good Samaritan Nursing Home in Sayville. Thanks so much for being here.
Thanks for having me.
So talk to me about, on a daily basis, what does a chaplain do?
We really meet the spiritual needs of an individual person where they are. And like right now, my assignment is in a nursing home. So my focus is sort of, okay, what are the spiritual needs of the people who reside here? Sometimes that takes the place of a social visit, saying hello to the person. Sometimes it takes the form of really helping them grapple with the spiritual need that they have, whether it's a decline in their health, losing a loved one, or sometimes a family conflict, and hopefully being able to minister from a spiritual place to them to provide for their spiritual needs.
So talk to me about the day in the life of a chaplain. Do you make specific rounds like doctors, or do you get called in, or how does that work?
It's a bit of both. So in either a hospital or a nursing residence where I work now, I'll do rounds. I'll check in with each person, and we serve people of all spiritual beliefs and needs. And then also if I'm called by the staff, who often get to know something before I do, person's change in their medical status, or the person may have had a loss, or they may just be feeling depressed that day. They'll check in with me usually in the morning in a meeting to say, this person has had this change, we'd really like for you to help.
Do you ever encounter people who, I don't know exactly how to put this, but maybe they had no faith and all of a sudden they are finding faith, or maybe they're really angry at God, or all of that? How does that work?
I think that chaplains have a unique opportunity to be with people exactly at those times, because I think in faith communities, people aren't comfortable saying, I'm mad at God because I'm sick or because I lost a loved one. And for me, I think that's a really important ministry, because I think I speak for myself and my colleagues that we accept that. I accept it when people are angry at God, because I feel that it's a reflection of a change in their spiritual life, in their growth. And they may come, afraid to say it. And I think that our belief shows that it's okay to be mad at God, and to bring that anger to God and to help them do that, I think is an important job, important calling for us.
And how about people who don't believe? Do they still want to see you, or do they get mad?
Have been thrown out once, but I like working with people of no faith background, because the spiritual needs, we define them as spiritual. Illness, my life is changing, my family doesn't perceive me the same way now that I'm sick. All those spiritual needs we can still attend to, even if the person isn't from a traditional religious belief. And I think I look forward to playing a role, because it's God's world, and his world is a bit mysterious, so I cooperate. And I actually have a really good story about that too, if you'd like to hear.
Sure.
There was a patient at the last hospital where I was, and the gentleman was in the ICU, and I was doing my rounds, and I announced who I was, and right away he said, "Religion's not for me." And I said, "Okay, great. Is there any way that I can help you?" And he said, "Yes, I would love a joke." So I told him a chaplain-approved joke. It was very clean, but pretty funny. And that was my ministry to him. I visited him 3 or 4 times before he left, and I think he enjoyed that moment of being respected. He enjoyed that moment of sharing a laugh, which he really needed. And I think it was a good it was good for both of us.
So you let your inner chaplain comedian come out in that case.
Exactly.
So talk about this, ministry in microcosm, which is
Yes.
apparently very specific to a situation or a patient.
Yeah, I feel like we minister in churches, faith communities. They talk about the beliefs of a faith, the rules of a faith. I think we're able to sort of take that ministry and those beliefs and bring them down to a really tiny particular circumstance. So, if we spoke, for instance, of people who are angry at God, or families who need to have reconciliation, who may be multiple faith families, multiple belief persons. There are some people that I know that, were raised in a certain faith, moved to another, and now they feel they're a hybrid of both. And now they're facing illness, or now they're facing, this medical challenge, whether it's in a hospital or an outpatient clinic, for mental illness or chemical addiction. And so I think a chaplain's able to really draw from the deep well of their faith and then really minister to this particular person. How will they keep their relationship with their Creator if they want to keep it? How will they maintain their meaning and their way to cope with life? So you're able to really go, I think, to listen in a specific way and to reflect back to them in a specific way. Hopefully that maintains hope for them, whatever that means for them.
So talk to me about the loneliness of illness that you see.
Yes.
Because that's got to be heartbreaking.
It is. A chronic illness is a lonely experience. And we as chaplains are educated to understand that. I think when everyone gets sick, and I include myself in this, we want to maintain who we are. I still want to be the big brother, the uncle, the friend, the chaplain that I am. And then when illness comes, that starts to take away our role because we're less powerful. We might not be able to physically do things. And it's very tough for a family to see that because we want our loved one to be whole. So a chaplain is really able to minister to that loneliness because we don't have an expectation of that person. That person can be sick with me. They can be weak and angry. And I won't hold on to an image of them that was from, they don't need to be my dad or my son or my friend. So I think that's really an important aspect, that the chaplain can always be there in that intimate space with the person. They know they have an ally always. So that I think that's really our call.
But does it ever get too heartbreaking to handle? Because you're there in some really bad moments.
It gets very sad. And I think that as passionate people who believe in a loving God, we will be moved. I'm moved often. And I think I just had something really sad happen yesterday, and that's coming to mind. We lost someone in the residence. And I was moved by the compassion of the residents for this person. And I cried in front of them, and I thought that was fine. Because I said, well, if I'm going to expect people to be open and to face God openly, then I have to do that as well. And so it is tough. But I think if we maintain our humanity with people, show that we are ministry, but we are human, I think that helps us. And I think it also helps the people we serve. It's tough sometimes.
I'm sure it is. Thank you so much. We're going to take a quick break, but continue our discussion right after this. Welcome back to CHS Presents Lifestyles at the Heart of Health. We're back again with Jim Spencer, the Senior Vice President for Mission and Ministry at Catholic Health Services, and Stephen Ott, the chaplain at Good Samaritan Nursing Home, to continue our discussion about the importance and the job of chaplains. So we don't want anybody to go away thinking that you have to be Catholic to participate in the chaplain services at Catholic Health Services. If somebody asks you for a rabbi, etc., you even have them on staff, do you not?
Yes, we do. We have, depending on, really, I think the spiritual care department, pastoral care department of a hospital should meet the needs of the patients that use that hospital. And so I think if there was a large Jewish community, we would certainly be able to meet the spiritual needs of our Jewish patients. If there was a large Muslim population, we would certainly be able to meet the spiritual needs of that population. Eastern, Western religious traditions, or no religious tradition at all.
Yeah. So, chaplains, we've talked a lot about the one-on-one and being there in times of crises, but you do other things too. So talk to me about your other duties.
So at the nursing residence where I am right now, I'm basically the leader of all religious prayer there and religious services. So I get to organize the religious services. Sometimes I take part in them. I take part in helping people make ethical decisions as well, to sort of, facing different big medical decisions. I'm able to provide input to help. I think it's, of course, the person's decision in the end, but I'm there to help give them a focus, to weighing their decisions.
And then what about the staff? Do you have services for members of the staff, or do you have counseling for them? How does that work?
Yeah, the needs of the patient, the needs of the staff are very, very important, because some of our staff, they get involved in situations that are, they get to know patients, they see, especially if you work in the trauma department or the intensive care unit, that can take a toll on you as well, and so we need to be able to debrief, encourage the staff to debrief themselves, post-traumatic stress. There's a lot of things that you can do for a group, because if you just harbor that, it just festers, and it comes out in strange ways times. We also work with mental health.
Oh, so
we know when to refer to our mental health care providers, when it's a spiritual issue, when a mental health issue is clouding a spiritual issue, or more a health issue. So there's a lot of teamwork that goes on.
So our staff members have a spiritual life too, and I think just like as chaplains, our humanity is involved, so is the staff. And sometimes they can be silent grievers, people who aren't necessarily recognized. So in our residence, we recognize the staff. We include them in prayer, particularly for a resident who's dying. We also include them in final services, however that may come about, to really recognize, their spiritual life is involved too. And then I also follow up, particularly with staff who this may be their first experience of a very ill patient or losing them, to hopefully transition them into a hopeful place, so that they're able not necessarily to build walls, which I think some people say, oh, you've got to build a professional wall, but rather to have a hopeful heart and to be able to traverse these things in a hopeful way that keeps them spiritually healthy and spiritually wanting to come to work.
Is there a chapel in every hospital?
Yes.
Yes.
And fine chapels that people can visit on a regular basis?
Some of the chapels at the hospitals and Catholic Health Services, well, we are blessed to have 4 religious congregations were foundresses of hospitals, and they would all go to Mass, and the chapels are just amazing. They're beautiful, and so we're very fortunate.
So what do you think is the difference between hospitals like Catholic Health Services, where faith is such a big part of the healing mission, and hospitals where there isn't that same kind of faith component?
Well, I can say I don't know what it's like to be at one of those other hospitals. However, people from those other hospitals, and I don't mean that in a judgmental way, but they have said, we just don't have an answer to that faith-based identity that you have. We provide spiritual care, but there's something more rich about how we do it, and it's not just in the spiritual care department. It's the nurses, it's the physicians, it's the everybody who works in the hospital.
You have worked at other hospitals.
I have.
And can you compare them when you take the faith component?
Yeah, I think that what I've heard often from people is that and this is people across different beliefs, is they say they feel welcome. They feel spiritually welcomed in a Catholic Health Services hospital or residence, and that they're able to both express their spiritual lives and have it fed by one of us. And I think that's a great testament to, there are great medical professionals all over the world, but I think it really says something about a place where someone also feels that they can encounter their God through their experience with us and have their spiritual life maybe even grow at a time of crisis rather than just muddle through. And I think that's been the difference that I have seen.
Have either one of you, do you believe you've seen any miracles in these hospitals?
I have. We recently lost someone at my residence, and a resident who has advanced dementia, doesn't speak very much, approached this person's daughter out of the clear blue and hugged and kissed her and asked her if she was okay. And I found out that when she was well, she often took care of sick people. So it's a beautiful miracle of love. And this was something I think, it wasn't a vision, it was something even more beautiful, I think, which is a person being able to express their love for a grieving person in that moment.
And despite their own illness.
Despite their own illness, right.
When, with our audience that's watching today, if they feel like they need your services, what do they do?
Well, they could certainly talk to the nurse. CNA, they could say, I really would like to, I'm struggling with some issue. I had, sometimes when I was on call one night, I just got a request, somebody wanted a Bible. And so we brought a Bible, and it led to an hour-and-a-half discussion. There was some deep healing that was not dealt with. And so I think that's probably the easiest way. And you can tell the nurses, they have a sense of when they're attending to patients and family that they tend to call us and ask the patient or the family if they would like a visit with a chaplain.
You guys deal with some really heavy-duty issues, and I'm just curious if there's ever times that you're going, oh, what am I doing here? Or if you say, this is just the most rewarding thing I could ever do with my life.
Well, I would say that it's very, very rewarding, and a lot of people don't understand that. But in my role, I've come to appreciate that there are well-trained, phenomenal chaplains in our system, and sometimes it's best for me to just get out of the way and know that our patients and families and staff are well taken care of.
And you pride yourself on the education and the training that you've given the chaplains within the system.
Yes, to get certified, 1,600 hours of clinical pastoral education, master's degree in theology or divinity. We have one of the best CPE programs in the country. So Mary T. O'Neill, one of our CPE supervisors, is very, very well respected across the country.
Thank you very much for being with us. Keep at it.
Thank you.
As always, for more information or to schedule an appointment with Catholic Health Services, simply call 1-855-CHS-4500 or visit chsli.org. Thank you for joining us today. I'm Jane Hanson, wishing you goodbye and good health.